Thank you, Animal, for the introduction. Today, I would like to tell you my story, my health story. It is a very personal story, but I believe there are things for everyone to learn from my story. Because of that belief, I am prepared to share things publicly. Yeah, and then share my stories publicly here with you, which normally stays very private. The theme of this Garma festival is Yual Lakarana, truth-telling. This is my story. I am telling you this story so that you can understand from a patient's point of view. I ask you to listen and learn. My story is about powerless, and it is about learning how it feels to be empowered, even when you are very sick. I want all my people to experience that feeling of power, so I tell you my story for them. Some people might feel offended by my story. I do not want to be offended. Just to tell my story. If I am critical, it is a prayer criticism, a prayer that things might change. Too many of my people die young, perhaps 30 years younger than non-indigenous people. I would like that to change. I believe that people here today can be part of that change, especially if they listen humbly and think about how they can work together to make things better. The problems we face as a community are very complicated, and they are interconnected. It will take a lot of people working together to turn these things around. I understand this, but please listen to my story so that you can understand our experience too. I was not at Garma last year. I had a blood in my urine for a long time. I was going to clinic and they were thinking about what might be wrong. I went back, and then they explained to me that there might be a tumor, but I needed to get it checked out. The doctors in Darwin could take that out. That's why I went to Darwin and Miss Garma. I had an operation in Darwin. They said there had been a tumor, and I understand they'd taken it out. That's what they told me would happen, and I thought that's what had happened. I came home, and I still had blood in my urine. But I understand that would happen after an operation. They told me that the result would be sent over. I missed the first opportunity because there was a funeral that I needed to be involved in. I thought that because I had just been to the hospital, that would be all right. When I told the clinic, they said, okay, they'll make another appointment. In November, I still had blood. I asked the clinic if the result were ever going to come. 2 days later, they sent me to Darwin. I hadn't spoken to family members about my problem. The fear of cancer is like a bushfire that goes rapidly across the land. This is the only understanding that my family would have had. My father was a cancer patient, and he was told not to go to the hospital and that would have happened to my life too, because some of my family would have said, "No, don't go. It is just too risky." They think there is nothing going to be done. When they hear the word cancer, that is the death warrant. That's when community has a fear of sending one away. I went to the hospital in Darwin. They said to me, "Hello, George. Here you can fill in some paperwork." They told me to put on a surgical gown. I didn't understand what was going on. I thought the tumor was gone. I was very confused. The doctor talked very fast, and I didn't understand a word he used. I was very happy my daughter, Melanie, was with me. But when she didn't understand either, I signed a paper and they brought that meant I understand, but I did not understand. That was when we rang a friend in Melbourne. That doctor spoke to her too. She asked if they were going to do any more scans before the operation, but he said they would out was going on in the operation. We wanted time to talk about these things, but he said if we went later in the day or maybe tomorrow, they would not operate at all, and I would have to wait for another 6 weeks. My friend spoke to the doctor in Melbourne, and they said, "Just come down here and we'll look after you." That doctor looked very surprised when he saw me get dressed and walked out of the door. The next day I flew to Melbourne. I went into the Olivia Newton-John Cancer Centre at Austin Hospital. I think Olivia Newton-John is a very lovely lady. If Grease was playing, that would have cheered me up a bit. Professor Damien Bolton looked after me in Melbourne, and his other doctors. I had scanned and other tests. I had lots of conversation about what was happening, and people made sure I really understood. All this was because before they touched me at all. My daughter and my friend were in every appointment with me. We all asked questions. For the first time ever, I was called by my Yolngu name. It was written on every chart. People pronounce it correctly because it was written phonetically for them. Nobody called me George, not once. After the operation, it was very hard. When I was in my bed, I heard the voices of the old people. They are ready to take me into the next world. I was singing, and my daughter was worried because she knows that when old people sing, they are getting ready to journey on. She kept telling me, "Stay positive," and she cried. She said, "Daddy, don't leave me. Daddy, don't go yet." That kept me strong. She understood I am a spiritual person, and she kept me strong. Later, we found out that the cancer had gone through the wall of my bladder. There were a few different ways the doctors could deal with that. Professor Bolton said to me that if I was his brother, he would take my bladder out. That would change my life, but it was what he recommended. I trusted the man. I still trust that man. He is my brother now. I went back to Darwin before the big operation and had heart tests. But the Royal Darwin Hospital lost the result and I had to have them all redone in Melbourne. They still called me George. It took 6 hours to take my bladder out, and afterwards I was very sick. I was in hospital for many weeks and I nearly died 7 times. Through it all, the nurses were my guardian angels. They stayed with me day and night. My daughter, my friends were there every day. And Greg and John weren't. Matterly, Kato, and her 2 little ones visited me. I wanted family to be around me, and there they were. When I left hospital, I went to Lorne on the Great Ocean Road, and I can't see because my tears are running down. I feel every bump we drove down there, but it was the beginning of my healing. Last week, the end of my healing happened with the ceremony on my country at Bogordal. My nurses flew up to be with me. They are still my guardian angels. It has been a big judgment living without a bladder. Early in my life, I trained as a Yolngu health educator, and that made me confident to make difficult decisions and to know that I could look after myself. I understand that Aboriginal people living in remote Australia often have complex medical problems. I understand that doctors in this community work very hard to provide the best level of care they can. I appreciate the work they do. I know they often don't get enough support when we cry for the loss of loved ones. Some of them do too. That must be hard for them. I understand that it is often hard to get first-class doctor to live in remote Australia. That is why when we do have good doctors, we want to see them receive the best support so that they do not burn out. We also need to find ways for members of our own community to be empowered about their health, to step up as Aboriginal health workers so they can help everyone to make informed choices about their own health. We need our people to be given proper medical training. People who can lead health education program in our community. When I drive down the main road in Mununggurr, I see the campus that Flinders University has built here. I understand that it is for research, and I support that. But please listen to our practical needs and work with us to meet them. As a board member of YYF, I know of the partnership we have with Melbourne University. I know Miwatj also have partnership. Let's all work together. We want people who can become bilingual advocates for patients in hospital so that people can truly understand and make their voices heard. We want hospitals to be culturally safe. That isn't the same as being culturally aware. It means being called by correct name. It means no racism. It means voices being heard. It means understanding our cultural context, our spiritual context. It means not assuming they know best. Help us to understand, empower us to make good health choices. That doesn't just happen. Doctors need to be trained. Nurses need to be trained. Every staff members needed to understand. For Darwin Hospital, my story should have a clear message, a clear message about communication, a clear message about caring. I am a young person, but I want those doctors and nurses to imagine that I am their father or a brother or a son. I want those doctors to be honest, but not in a way that will frighten me. I want them to explain things clearly and to give me room to ask questions. Not just say, this is what we will be doing, this is my body. I want to know what will happen to my body. I want those doctors and nurses to know that I am a spiritual person too. I want them to respect my spirituality. So when I am sick, too sick to think for myself, they will respect me as a spiritual person and make sure there are people around me who understand. I will finish now, but there are a number of people I want to thank publicly. Donna Orchard, a company secretary for Lenapwe, who kept on sending flowers and get better wish letters. Same applies to YYF board and the CEO, Denise Bowden. Professor Damien Bolton, nurses Ursula and Naomi, my two angels. All the nurses on Ward 6 south of Olivia Newton-John's Cancer Center. My daughter, if you're watching this live, you're my hero. And my Japu family and the Melbourne family. Thank you very much.